Hi, this is Jay from LifeRx Wellness, and today we're going to talk about sales. Sales for a massage therapists, for fitness instructors, for all this health industry people who providing that service. And a lot of therapists come to the class and we talk to them and I say, so how's your sales skills? And they always say, oh, I'm not a salesperson. I'm a massage therapist. I'm a healer. The professional salesperson, in my opinion, in my vision, this is the professional person who can provide service very quick, most beneficial for the clients. And this is what the service, and he knows what to need. Most people, they kind of, they underestimate their service, or they scared or provide service because it's also related to the money. But like I said, if you know what's the best for the clients, you always try to sell, try to push the clients, the service and what he's need. It's the other thing is if person buy your service or extend your service, it's a different. So how to do that, how to not miss this communication with your customers and keep your customers for a long period of time, and prove your clients you are the best, can truly help this person. This is what the class is all about. So the biggest mistake, if people get booked online or someone just text a message, they just put this in whatever your system use, or maybe like you even put some on a piece of paper, or you put you on the phone on Google Calendar. You never call these clients because, from my opinion, you have to call your client and know what's going on with your client before you go, or the client before come in, because we do home services. It's also beneficial. I'm going to explain this in a minute. So, or people come to you, you explain them, where's the parking, where's that, you also send them email with all this information, but you call the first time customer and personally talk to him and ask the questions as much as possible about what's the treatment about, where is the pain, what's the bother you, to make sure even this is your client. If someone book you for lymphatic massage and you're not doing lymphatic massage, what's this all about? I mean, you don't want to waste this person's time. You don't want to waste your time. You make sure this is your client, and like I said, put as much information as possible. And people like it because you truly care, you truly worry about these customers, and I really do, because I need to know as much as possible. And if I don't know something, let's say I called the client and he said something like he got some in the past, like Lyme disease. If I knew massage therapist, I don't know what to do. So in my case, it's great. I'm gonna go online and I'm gonna read about Lyme disease. I'm gonna read about this and see if I can do massage. And sometimes the massage is contraindicated and I can't even work on him. Like a person come in with an epidural shot in the neck, and I know I can't work for 15 days. 15 days have to be break between those shots and my massage. So this is good stuff to know, because sometimes even you send them like intake form, those questions, you do soap notes, people don't put this information. That's why it's important to ask those questions. And in mobile service, the massage therapist, the agent who work with us, they never call him. They make that first step as they skip that first step. And guess what? When they go to massage, it's let's say it's a big complex, and you don't know where to park the car, you don't know where to go, and you create that stress. So customers is waiting up there, and you come in like 10 minutes before your massage. You don't know where to park, where to go. You start calling the clients. The clients get nervous. It's create the chaos. But if you call the clients a couple hours before or day before, if it's been pre-booked for a couple of days in advance, this is great stuff, because like you know where to go, you don't create that stress, and this is the beauty of this thing. So this is the first step. It's call your clients. The first time clients you need to call. This is create the image of the professional therapist, and very, very beneficial. I also sometimes go on the people's social platform. So because people send you the first name, last name, email, so I can find them on the social platform and see what people doing, how they look like. And yeah, I do this all the time. So and let's say the one guy is book massage, and I know he's a big fan of the fishing and stuff, and I get some little bit information about it. So when I come in, I start asking him questions, and he's like, "Oh, my shoulder is hurt," and I say, "Oh, you're probably fishing," and he's like, "Whoa, how do you know?" You see, all this kind of create that professional environment between you and the clients. So, and the next step, it's a next step. It's a second step. It's a introduce yourself and ask as much as question possible with your client. So today we have a Daniel. We're going to break the Daniel down and do some assessment. So this is how it looks like if I get a new client. And he's actually I've never been the client. So go ahead, come over here. So this is the Daniel. And I know some of you guys have an English problem. Oh, do we see it? Let me pull this camera up so you can see our faces. Can you see your face?
Yeah.
All right. So introduction, and I see a lot of massage therapists from like Europe, from other countries. They never ask the questions. The usually meeting is like this. Hi, let's say I'm Jay.
Hello, Jay. How are you doing?
I'm doing good. What's your name? Well, your name is Daniel, right?
Yeah, that's right.
Okay, Daniel, how you feel?
So.
So. Where is the pain, Daniel?
Like in my right shoulder, in my right hip. Like that's where I'm kind of feeling that the most.
And that's it. So, and he said, okay, let's go to the room. And they bring the person in the room, and that's probably about it. And I see this so many times because, especially in those spa or those fast massage places like Massage NV, they don't ask questions. They don't have that time between the clients, and this is really poor service because you truly need to know what's going on with your client and ask at least those 10 questions, which is we do all the time. Let me grab that book. That's why you need to know those basic questions and the basic assessment. It's right in here in our Massage RX book, which is we created. It's really helpful to read this book to understand what your client needs, what you're looking for. And guess what? We get this class on August 16, 8:30 in the morning here in Los Angeles. You can join our class personally in the class and go through this program. It's 8 hours program, and it's a 50% off on sale right now. So we would love you to come over, learn, and start grow your business, grow your professionalism, and of course, grow your income. This is what's important. So August 16, 8:30 in the morning, 8 hours program. You can also do live streaming on a Patreon or Facebook, YouTube members, and personally in our class. So this is what I do when people come in. I'm introduce myself. So Daniel already come in, introduce myself, and all about Daniel right now. So Daniel, tell me what's you bring to my office today?
So I have a limit of motion in my right shoulder.
Okay.
So I had an old injury probably 10 years ago. Since then I never finally cured it. So I did probably the wrong rehabilitation. So range of motion is still kind of limited. From time to time, if I'm sleeping on this shoulder on the right side, I might even feel the pain. I was doing some massage therapy, some chiropractor adjustments, so it's kind of good for me. It's not bothering me in regular life, but if I'm kind of trying to be sports active, I might feel some limit of motion and stuff like that. And I feel that's even in chest press or some exercises, I feel that my limit is not the muscle, it's just some kind of maybe the joint, maybe the tissue around it is limiting me. And also I have a long-lasting pain with me in my right hip. It's kind of has sciatica pattern, but it's not I guess a sciatica kind of thing. I have I did the MRI. I have a small tear in the labrum joint, and as the doctor explained me, that's why I have inflammation in all this area all the time. That's why these muscles kind of always tight. And yeah, I'm working on it to give it enough stretch, to give it enough work to the hip muscles, to balance everything out there, like the small tear in the joint. So that's kind of short story about me.
Short story. Was wow. He's a massage therapist, so he said everything what I need to know. But yes, so let's go slowly. You see, I never interrupt my clients. I always listen. I never say the word. He basically answered all my questions what I should ask. And my first questions, yes, it was been injured. He said it's been injured. It's been injured that right shoulder. So he's already tell me what's help him and what's aggravate him. So how constantly is the pain? Like you said, every other month, every other week?
With the shoulder, it's not that often. I mean, like pain. I don't feel like there pain. I will feel pain only if I'm kind of trying to go over my limits in the like mobility kind of exercise or any kind of activity. Yeah, with my right hip, I might have like a constant pain. It's not a strong one because I kind of do a lot of management things to keep it in a good shape. But previously, like a couple years ago, if you would ask me, I was in really bad pain. Like I was not able to press the gas pedal and everything. I was irritated all the time because the pain was super bad.
Okay, so you see, I'm writing everything down because it's important to create that soap notes. And you guys know to create the soap notes, it's a high level of professionalism. Why? Because people come back, you already know what's the issue. And you repeat this issue to the clients for the next time, they're going to be impressed. They're like, oh, he still remember. Sometimes the clients, you never write down, the therapists never do soap notes, and Daniel is going to come back in a couple of weeks. Let's say he's going to somewhere, and 3 weeks later he's come back. I don't remember what the issue was with him. I'm going to be guessing again and ask those questions, so I'm going to waste my time. My client is not going to be like, oh, these guys don't even remember my right shoulder is one in pain and my hip. And this has happened a lot, and I see this. Or sometimes people come in, the therapist, like, he might remember that was the left shoulder or was a right shoulder, and he start working on that left shoulder, but the problem was on the right. And it's kind of take the clients off. They really not happy. And you can see the faces. They're like, oh, that was my right shoulder. And that's why you write the stuff down and put this in the soap notes. And if you have this professional what's the called application, you can also drawing up there, write everything down, pain level. So I asked the pain level. Tell me more about this pain. Is that the sharp pain? Is it dull pain?
During like the regular day activity, nothing. But if I'm gonna try to do something, it's gonna be like a sharp pain. For example, I can't even like fully place my arm behind my back without feeling the pain here. So I would say it's like maybe like 5 or 6. If I will go really hard, I might be even like 7 or 8. But yeah, that's kind of the level of pain I have.
So ask what kind of pain, what's the level of the pain, because after the treatment you're going to re-ask those questions again and see if this is decreasing. And during your massage treatments, it's the level of the pain is decreased because you want to see the progress, you want to see the benefits of all this work. Okay, so you can ask a bunch of questions. He's answered almost everything. Like what's help you? What's to release that pain? Do you do any stretch or anything like pressure points?
I mean, with my shoulder mobility, what helped me a lot, I did some exercise with yoga stick. Some things like you taking the yoga stick and you moving the shoulders like this, or you placing the one like that, and you working on range of mobility in that kind of pattern. So I did these things.
Turn again, and show me again. Show to the camera what you do.
Okay, number one.
To turn this way, yes, perfect.
Okay, so number one, you're taking. I mean, I can even take the yoga stick to show.
Yeah, no, just show it to me.
First things first, without trying to bend in your elbows, I'm going this way.
So
that's like number one. Number two, I was working with my right shoulder like that. So imagine there's a yoga stick in my hands. So this hand just grabbing it passively, and I'm moving the yoga stick up just to work on that kind of part with my shoulder. And the other one, again, imagine the yoga stick is here, and I'm trying to work on this motion because that's the most limited one. I guess some rotator cuff muscles are super tough still, and I can't even, like, for example, if you ask me to stay like in front of the wall, I won't be able to position my arm like with 90 degrees to my body.
Okay.
Still.
So you see, he's already telling me what's exercise help him, and what I saw when he's trying to do the stick exercise, his head is tilted to the right and he's bent his head. So something is telling me it could be not just the shoulder, it could be his neck. So I always pay attention. I'm never interrupt. I write this stuff down and I basically ask all those questions. I see the thing what I need to work on. And now it's a really important, it's a $1 million advice and tip for you. If you guys want to start to make good money, do not lose the clients, pay attention right now because it's really important. And what I'm do, I always can say start doing postural balance, postural assessment, palpation. I always try to before. I usually try to find some problematic area and point this problematic area in this client. Let's say he's not able to move the shoulder. I'm going to say, oh, you see that shoulder is bad. You can't move that shoulder. Look at this. Your hips is out. Look at how you're standing. Your foot is collapsing. And that's what this is what I usually do in the beginning of my practice. I'll be honest with you, 15 years, last 5 years, I started using differently. And yeah, I lose the clients. Why I lose them? Because they come in, they in pain, they need my support, but I come in and I point it out. Because I set my mind as a teacher for a massage therapist. This is my plan, this is what I'm going, and I always pointing, look at this problem, look at this problem, look at that. And clients, they get scared. It's called also nocebo effect. Like, you go to the doctor and doctors say, oh, you can't run anymore because you're going to blow your knee or you're going to die because you're hard. And this is create this nocebo. Yeah, this is what the real thing is. That's why we don't want that. We want to find at least 3 things in his posture and let him know. And after we create the treatment plan and build up this practice on him and relationship between you and Daniel. So remember, if I be you, I would start, okay, just go ahead, stand up and like, all right, looks really good, very strong, the good postural. Yeah, that's very nice. Now I'm going to do those test assessment, and if I find out something is bad, I'm not going to like, oh, this is really bad. This is fucked up. We don't want that. This is what I did in the past. So you guys remember this. It's going to change your practice. People are going to love you, people want you, and if you do all this step by step, you're always going to create sales. And remember, the sales, this is you, this is your future, this is your money, this is your income. If you do this floppy, if you don't follow those steps, you're always going to be struggle. You want to keep struggle? Okay, do your way. If you don't, do please my way. Not even my way, because it's all professional therapists do this, and that's how they teach me. Because in the beginning, I did the same thing. I know everything. I don't want to write anything, and that's scare those customers. All right, so the next step, it's 3, introduction myself. So he tell about the pain. It's all about my clients. It's all about him right now. Usually it's take up to like 15, 20 minutes. That's why the first session is kind of introduction session. I usually add like a 15 minutes or I do some discounted price so to make sure the clients feel comfortable. So Daniel, I'm not sure. So we have 2 ways to correct that. We can create long relationship between you and me, and we can do postural assessment. We can do muscle testing. We can, and that's take about the next 20 minutes. And we're gonna build up this program for you and keep working on that shoulder. So it depends what you're looking for. Or I can just give you a massage without all this assessment, and you're gonna feel good, but it's might be come back and we don't find the cause of this pain, the roots of this pain. And most of the time, people say, I just want massage. That's it. They just say, I just want massage. Just massage me, please. Just dig in there, and that's fine. So you're like, okay, and you might do this first treatment like just a regular kind of deep tissue massage. But if he's during the communication, you might change his opinion and start doing those assessment. But today we're going to do assessment. So my first assessment, Daniel already told me something going on. This is our program, which is in our book. It's called 7 Lucky 7 program, points. So what I'm looking for the keystones and look at the Daniel as a one big piece and structure. So let's take that shoes off. We're not going to show you guys the ankle because it's the camera. Yeah. So what I'm looking for here, he's standing up. I asked the client make a couple steps. There's a couple steps and look straight in front of me. So now I'm looking at the postural. What I'm looking for, I can go from the top to the bottom or from the bottom to the top. It doesn't matter. It's all your way. You check those points. And my first point, it's that ankle, and see if the ankle is collapsing inside. If the foot is doing this, like this, that valgus leg or this ankle collapse, it's a lot of problems. And guess what? If you have this ankle problem, you're gonna blow your hip, the knee, and it's coming all the way up. Because this is your fundamental, this is your concrete. Think about it, if your concrete is like not mobile, your foot is not mobile, your ankle is not moving, it's go all the way up. So it could, exactly, foundation. People say my shoulder, but the problem is going to be in the ankle, and it's happened a lot. So let me, just because my head is going to cut a little bit. So what I'm looking for, step a little bit to the right, so here we go. Okay, what I'm looking for, his ankle is absolutely fine. I don't see any problem. I see this little bone is kind of grow up here on the side at bunny toe, on the big toe. Here we go, thank you. So this could be that collapsing that ankle. I would probably suggest to work on that ankle, just create that stability. But he's pretty good. You can see that arc. It's not flat feet. Flat feet is usually the problem. Next one, what I'm doing here, I'm going to the knee. I just find that knee, try to relax. You see, every time I touch that knee, people start like contract that quadriceps and that patella bone start moving. So I just say relax, let everything go. You see, he's doing this again, relax. And what I'm looking for, and what I see, this knee is lower, this knee is higher. Now I'm going to all the way to the hip. And what I'm doing here, I find that anterior sacroiliac bone. Let me grab my spine. So I find that anterior, there we go, right in here. And what I'm doing here, I just slide my fingers down and see if this is leveled. If not, what's happening here, we got all those tilt, rotation, tilt, so let it go, And what I'm doing here, apply, find that anterior, and here we go. So same issue. This is one lower. Can you turn to the camera? Yeah. So here we go. Do you see that? Yeah. So this is the difference. It's probably like a quarter of inch. So now think about it. If you walk in that quarter inch, your ilium is shifted. All this motion, and it's create disbalance in this area. Also, what I'm looking for here, if you have any anterior tilt, if this kind of rounded, this lordosis, and he do, look at this, it's rounded. Yeah, it's not that bad, but it's rounded, so I will probably pay attention. Ask the question, do you feel like a hamstring sometimes, like a pull you, or you need to stretch that hamstring, or you feel good?
On the right side a lot.
Yeah, so you see, he's already telling me, go ahead, turn face towards me. So he's already telling me on the right side, remember this side is high, so this ilium is rotated. What's that's going to happen? It's going to pull that hamstring. And most people, what they start doing, they start stretching this hamstring, but the hamstring is already stretched. It's isometrically load. So it's constantly load, and you're going to stretch more. What's going to happen? You're going to create more injury. So don't stretch, train. A lot of people start, stretch everything. No, you need to train. You don't need to stretch, especially that hip flexors muscle. So it's telling me something going on up here. I'm looking, I can go up. I can ask him to do this, our favorite test. Go ahead, turn around. Find that posterior sacroiliac bone and see how that ilium moving when he's bending forward. So let me turn towards the camera. So I'm holding right here. I'm already see it's out of balance. Now bend forward. and come back slowly. You see what's happening? This finger is stay where they are. It's on this level. But that one, when he's bent forward, it's pulling and it's moving. So every time he bent forward, this hip is pulled up. So this one is nice shifting back without any lifting up, without changing the level. But this one, it's caused the problem. So every time. So this kinetic line, whatever we have to find out, is something going on. So we need to release that. We're not working individual muscle. We work that kinetic line, which is combination of tendons, ligaments, and fascia and muscles. Okay, let's turn face towards me. Okay, what I'm looking for his shoulder. You can raise the camera up. So clients, a little bit more up. There we go. So normal people, when people come in, they get this arm, this position. So that's mean it's not a lot of those shoulder internal rotation. If my chest is really dominate, if my chest so strong, remember they're attached to the humeral bone, and it's rotate that humeral bone. The stabilizer, it's your lats muscles, but if you slouch forward constantly, what's going to happen? This lats is loose to your pecs, and your pecs is going to rotate it. And most of the time, people come in like this. Exactly. I ask him, can you do this? Hoo, hoo, hoo. So I just have fun. But yeah, look like a gorilla, that hands inside, and they said, my back is hurt, and can you work on my back? Can you stretch my back? And I get this lady, she's rounded, she's like a seahorse, and she wants me to stretch that, because she goes somewhere at the whatever Thai place, and they pull that scapula away, and she feel good, of course, because she gets stretched. But she never open up anything up here. She feel good for 1 day, for 2 days, and everything is come back. That's why the difference between professional therapy and those streets therapy, obviously, big difference. Because we try to benefit you, try to help you, and eliminate that pain and find the cause of the pain. So I would say now I see at his neck positioning. So what I'm looking for here, as I see his neck is tilted to the right. So he's standing. He tried to probably correct it right now, but you can see it's tilted. So yeah, you always can see the tilted. Now, what I'm doing here, like I said, you can do this very, very quick. Bam, bam, bam. I do Burgeri test. I hold his occipital area, and I want him to come close to this table. No, just like this. I hold that neck, so occipital area, and ask him to sit down. Just sit down and get up. And what I'm feeling, one more time. No difference at all. So when people stand up and they sit down and you feel the big changes, big changes, that's mean the problem is in the ankle and the hip, right? Now we turn those away. So he's only sitting on his hip. So ankle, the knee, it's nothing up there. And you see if it's changed. If it's changed right away, from like instantly change, the problem is in upper body, nothing in lower body. If you feel that no changes, it's no changes, that's the problem in upper body. If it's big changes, it's a problem in your lower body too. Let's do again. Sit one more time. Just in the back, sit down. And I want to see how he sit down. Did his head change? Did his neck is?
No, I think it's the same.
Same. Let me go a little bit back. So I usually do this. Yeah. So you see, yeah, his neck is still the same. So the problem is it's nothing in the legs. It's something in the upper body. Go ahead, get up, stand up. So this is another test. Now we continue, break him down. I also want to see how he breathes. So I place my hands. I always let the customer know, especially women, I'm going to place my hand on the belly. We're going to check your breath. And you just breathe forward. And what you most see, he's pretty good. I can feel the both side. Yeah, the right side is stronger. Yeah, the right side is stronger. Sometimes when you see people not breathing at all, you place and they just like, I'm already breathing. And I'm like, okay. So, but the breath is not there. So what they do, they're like, they start doing this. So always try to restore the breath first. And this is really important because most people is not breathing. I place also on the rib cage here, come on from the side. I always let the customer know, breathe. You never break any ribs. What do you feel? I'm already feel the difference, but I ask my client, what do you feel? Which one is it pushing harder? Which one?
Like the right one.
Yeah, but it's already corrected. Just I let him know. He started think about it. He started breathing and last couple breath was almost equally. But first 2 breath, it wasn't there. So the brain is control everything. And you let him know, he corrected so quick. He's like, pop, pop, pop. Like that computer signal, like something go wrong and body recover right away. The sparking, the motor control problem. So next one, I want to see the shoulders, right? Shoulders. We do tests. It's a special test. You can do simple test. The simple test, it's called bottoms up. You bring to the, this is 0, so you bring to the 45. So because this is 90, this is 0, 45. Thumbs up, and I push against that arm. I push it up. Pain? No, okay. Painful side. I always start with non-painful. So here we go. Here we go. Well, I think you got a standing like, that's all right. So push up.
I don't feel pain, but I feel weakness.
Weakness, exactly. So he feel weakness. Why he feel weakness? Because his brain, no, this is problematic shoulder, and your primary function of your brain is protect you and keep you away from the pain. If you experience pain constantly, he always going to make that not working. That's why we do an exercise with the band to restore that shoulder. Okay, next one, it's a bear hug or bear hug. So what I'm trying to do, I try to separate, turn this way. So I try to separate this arm from the shoulder, and he resists. One arm is coming on that shoulder, another one try to separate. So you hold it.
I feel pain.
Pain. You feel pain or right away. So what's this test? This is subscapular test. Let's try this one. I mean, this is strong. No pain? No. Okay, one more special test for the subscapular. Just want to make sure. Turn him around, bring this arm in the back, and you push this away from the body. He pushed towards the body. Stabilize that shoulder. Let it go for now. Now bring it.
I feel pain. Maybe
pain.
A bit less, but
that's it. Pain. No matter what, it's pain. It's mean non-functioning. And people, with most of the time, they experience pain and they keep working on that shoulder. They keep going to the gym. They keep going do this job, whatever, sitting, without correcting this. And the pain, this is the messenger. Something wrong, something not right. Don't ignore it, and especially don't kill the messenger. Don't put those pills, exactly, those shots, and Advil, whatever, like heroin, whatever you guys do, whatever is cheaper for you. Yeah, because look, if you go to the doctor, they're gonna say it's $80 those painkillers, and you go to the street, it's like $10 heroin shots, or like $5. This what's the called fentanyl. Of course, I could pick the fentanyl, right? Yeah, $5. Hey, if you guys need something, give me a call. I'm joking, but listen. So next one, it's another test. I love this test. He placed that. We testing the right shoulder. He placed that on that opposite, and he started raise this elbow up. So elbow up. See if any pain.
Like in a top position.
Yes, so that's it. So he's got that pain. So we need to. It's already telling me it could be that rotator cuff problem. The shoulder is the issue. So we're gonna work on that shoulder for sure. Now let's see this mobility. I want you to turn around. Here we go. How he's like spinning around, not turning around. So grab your thumb just like this, and all you do is start doing this up without. I see this compensation. You see this head is start tilted. Look at that space. Switch. And look at that space. Can you believe, like, go again? The normal, it's the palm of your client. So look at that. Look at that difference. Of course it's a shoulder. Let's check the neck. Let's check the neck. Come back, turn around. Neck, what are you doing here? You ask your clients, put your feet together, always feet together. You guys don't see it. And the client is turned to the right, to the left, sorry. See this compensation, a little tilted on the side, and it's limited. I ask if any pain. Any pain?
A little like discomfort on the right side.
Discomfort, pain, it's the same. It's like I said, if people say discomfort, that's the pain. Try to go to the other side. Look at that. This is like almost no problem. No, it's actually great. Next one is going to be extension. He's going to try to look up. Perfect. This is like you're looking for 80 degrees. You measure this, you see that nose line, and this is your 0 point. So when you go all the way up there, that's 80 degrees. It's perfect. So he don't have any pain?
No.
No problem with extension. Next one is a flexion. So he's going to try to tuck the chin and find that sternum. Close your mouth. Always close by the teeth. And let it go. Is any pain?
I feel discomfort on the left.
Here we go. So now, as our book, we get that in the back, soap noting. We do all this stuff. We just write this down. So I write this shoulder, put this on the hip. I do all those tests. We're not gonna do hips. I mean, we can go deeper. Oh, we're going deeper. Yeah, let's go deeper. Let's go a little bit deeper. Why not? So let's break it down. So we have flexion problem. We have rotation to the left problem. I would say that neck to the right is absolutely fine. So now we're going to go deeper and check everything up. Let's check our ankle before we lay down. We're going to check our ankle. So go ahead, sit down. And what we're doing, I'm going to show him. You guys might not see it. But here we go. We got new operator here now. Here we go. So the test is the table is a little bit high. We usually do this in a chair. I asked that the clients put that hand on that ankle, on the knee, and try to rotate your ankle in and out without moving your knee. So you see what I'm doing? And see if you can able to do that. He's gonna lift it up a little bit, and now inside. Try to not lift it up, but that's good. Then that's fine. Now try to the other leg. And in. Good. Do you feel difference? I think this one is a little bit worse. Like, yeah or no?
But like you have to not
move just
the knee at all. But
you can move tiny bit. It's just because that's that. The tibia and fibula, that's the joints, as you're going to feel it. Yeah, it's fine. So he's good. So we good on the ankle. What else we can do? This is probably it. You can also ask him stand up and do this kind of test. Invert, invert. Yeah. This is another test. This is deeper. And you can see the difference how he's doing it. Bring it in. Yeah, that's fine. He's good up here. So now what we're going to do, we're going to ask him to lay down, face up. Face up. Scoop a little bit down so your head is on the table. So now we're going to go deeper for this neck. And what we're doing here, we check our flexion and rotation of the neck. Guess what? It's no gravity on the spine right now. It's no gravity. We release that spine. What we're doing again, we ask rotate Daniel to the right.
just the neck.
Just the head. Yes. No problem, right? Do you feel any pain?
No.
Now to the left. Remember the left one was painful?
No pain.
No pain. So what's that mean? What's that mean? He was standing when he turned to the left. He was limited, get some that limitation of motion, and he experienced pain. So now it's no gravity on that spine, and he's don't feel that pain. That means something when you're standing, It could be the problem with the spine, and it's limited. Usually, if your head is tilted on the side, that muscle is shortening and they pull and it's jammed, so he can't rotate. We need to work on the neck definitely and work on the shoulder. And of course, check our thoracic mobility because it could be a problem in thoracic mobility. So what I'm doing here, the next, if we go deeper, we want to check the flexion and rotation and OA joints. So here, how to check OA joints. OA joints, we're going to rotate to the right as far as possible he can go. I can help with my arm and start tuck the chin. Let's see if he can go 20 degrees. Go ahead, be on your own. Any pain?
Slightly on the right.
Slightly pain. So we have OA joint problem. Let's go ahead to the left. I can feel this limitation. It's still limited. It's no pain, but it's limited. So let's see if this is a mobility problem because we have mobility and stability problem. If he can do on his own, and I can do it for him, that means it's motor control problem. He don't know how to complete the movements. But if he can do it, I can do it too. That means it's a mobility problem. So he can do it, I can do it. This is mobility problem on the left side, and it's okay on the right. Now I ask him to tuck. Any pain?
More pain, like on the same kind of spot.
Yeah, so when he tucked his chin, he got that pain again. So we would say that upper partial of the neck is get the problem. Like I said, you guys keep practicing, you keep understanding, you keep learning. We got that book. You can join us seminar on August 16. You can watch online. You can even understand from this class, practice and understand what's going on. Next one, we want to check rotation. And how to check rotation, we want to check this in the flexion. So remember, if we check flexion, we do rotation first. If we do flexion, we do rotation. If we check rotation, we do flexion first. So this is the flexion. We go 45 degrees. 45, and ask him to turn to the right. We're looking for 45 degrees. Any pain?
No.
No. Go ahead to the left. No. No pain, right? I don't see any because people usually they close their eyes like this. So what we find out, we have a flexion problem. So we check the flexion. We have OA joint pain. Pain and discomfort, and it's a mobility problem, and everything on the left and actually both on the right side. If you don't know how to measure, we have specific degrees in our books, how many degrees supposed to be, and if you want more, I usually on my phone I get that clinometer, and with the clinometer rotation you can tell exactly, but I'm doing this for 6 years, specifically technique, and I'm already see where the limitation is. Okay. So next one, we want to check let's check our hips. Why not? And it's really easy test. The first one, it's a leg raise. What we're looking for here, let me just step behind the table. So what we're looking for, how he can raise this leg and without shifting, without compensation. And it have to be 70 degrees. Go ahead, raise this one up. Try to keep that neutral like this. And is that 70? No. Is that shakiness? No. Let me help him. And I can get in there. So this hip is a little bit limited. Let's try this one. Try to keep it straight. This one is same. What do you think? Is that 70? Yeah, it's kind of close to the 70. But I would say it can be more improvements. Now, next one, it's internal rotation of the hip, and it's a basic test. It's a favorite test, our favorite one. So you just bring this knee and put this above the upper side knee, and the distance between knee and the table is too big. It's too. Yeah. Usually you do the two fists, and you see that space. It's a little bit more. So have to be right in here. And plus he compensate right in here. And go ahead, switch. Boom, look at that one. And this one is no problem at all. It's like even one fist. So what's it telling me? And remember, he said that right hip is get that problem. So it's already, everything is telling me. We have that internal rotation of the problem of the hip. Also, we can do check the self. Bring this knee up, and remember, 35 degrees. I'm sorry, I'm not going to show you. So this one is fine, it's 35, and boom, external rotation of the hip. It's not working. Right there. So what I'm doing, I'm going to mobilize that hip. It's not a motor control, it's the problem in this hip.
The healthy one?
Yeah, let's check you're healthy. Sometimes people think this is the healthy one, but it's not healthy. Okay. So no, we try it. This one is, yeah, it's good. Let's just go that way.
Let's see how different.
Yeah, you see the difference? It's getting there. It's a little bit limited because I push it to make him feel good about it, but yes. I mean, it's a little bit improvements. Also, you can check that ankles in this position. You can check the ankles. You can do Thomas test. It's going to tell you it could be the soft tissue problem. Maybe that's quads is muscle problem. Maybe it's not the joints, but usually it's the joints. Let me teach you how to do. Before we're going to go do Thomas test, we're going to flip yourself on that belly and get this position of, it's called prayer position. No, prayer position. So baby child. So here we go. This position, we're checking our thoracic mobility. So the client is, get this arm together like a prayer. Now one arm is coming in the back, and make sure he's not compensated. He's not moving this shoulder. So what I'm doing here, I'm adjusted and hold him.
And his ankles need to be...
Yeah, no, it's unnecessary. The arms together. Yeah. No, he's good. He's too picky. He said he wants him to foot to touch each other. The arm. If people even can put this arm together, that's already telling me something issue up there. Go ahead, turn your head and try to look up and see how far you can go. Look at that. It's limited? Yes, it's have to be 55 degrees. Now I'm helping. I slide my hands up and look how far I can get him. So we have motor control problem here. It's not is that pain?
No.
Good. So that's mean it's not mobility problem in this thoracic. It's a motor control problem. It's a stability problem. Go ahead, switch. And now I'm going to show you on this one. So you see I'm standing here, lock that shoulder. I usually place my leg like this. So you see. Now go ahead, turn as far as possible. This one is better. And I try to help. Yeah, this one is better but still limited. So we definitely work on thoracic, shoulder, and neck. And OA joints, the upper body. Okay, now we're going to do Thomas test and show. Go ahead, stand up. I'll show you Thomas test. Thomas test, you check this relationship between your hips, your legs, and tension of the soft tissue. So usually you sit down very tiny on the table, and all you do, drop yourself down. If client have a lower back pain, we're not doing this test because it's going to provoke pain. So just lay down. Now bring this both knee towards the chest. And I see if he can pass this 90 degrees. So this is the 90 if you pass this 90. And I ask him to try to relax that. Drop one leg down, one holding. So I watch how, and look at this. Try to relax. Relax. There we go. He's more relaxed. But look at this, how tension is. This knee is in the air. It's not 90. It's not going away because sometimes you see people doing this, that going away. That hip problem, that bone up there is not allowed to go straight. So this is a lot of tension. So we're definitely going to work on that stuff. Switch. So bring this one up, grab, and boom. You see, this is what I'm trying to say. Try to do it one more time. Come back. No, just keep this one up. Bring this back up. Bring both, hold. And now slowly drop your left one and swatch. You see how this coming on the side first? And he's dropped that down. He tried to, you see that, he tried to control it, but it's still not. And you can see this one is also tight. So this quads need to be worked on, okay? Maybe hip flexors too. And this is it. This is how I help my client to get up and stand him up. So let's raise this camera up and see if I forget anything. Like I said, the idea is usually this testing and this communication with the clients take 15 minutes, like I said. So, yeah, stork test. Yeah, if people come in with the more like a deep pain, I do stork test. Exactly. So now we do functional test. This is, I usually start with that. For what I'm asking client, it's a testing test. See how this hip. So go ahead and stand up on one leg and see if any balancing. 1, 2, 3. You count to 10, 4, 5. See if any shakiness present. If you start compensate, that hip is coming up. And pretty good. Let it go. Now switch. 1, 2. You don't need to raise that high. You see that ankle is a little bit shaky, right? Yeah, I always ask the clients, where is the difference? Which one is the stronger? Always pay attention to
Well,
this.
I kind of was training this motion, so that's not
Yeah.
that.
You training, yeah, that's good. So let it go. Now the next one, it's a deep squat. So what you do in deep squat, you put your feet, yeah, like distance of your hip, and you try to squats. See if you can go squat all the way down. What I'm looking for, yeah, that's great. You see the back is straight. He's not leaning forward. It's good. Most people, their butt is in the air and they're doing this kind of stuff. They think, yeah, this is great one. Perfect. Next one, it's a thoracic rotation. So what we're doing here, you place that hands on the shoulder and try to rotate to the left. Look at that. He's pretty good. And to the right. I don't think it's a different. I mean, this is problem.
But I feel like kind
Yeah.
of pain when I'm turning to the right.
Pain. So definitely this cross kinetic line, something limited, and that's what we should work on. All right. Also I look at the eye position. We can do neuro training here right away, see if any difference. Let's actually try. Let's try to do some magic. So now remember Daniel was turning to the right, was difficult.
That was good, I guess, to the left.
To the left, right? To the left. Exactly. So yeah. So now what I'm doing, I ask him to close that right eye, yes. And just look at my pen. See if we can correct that. I'm very slowly move that pen close to his eye because sometimes we get that stuck in our visual. And that kind of stuff you can apply to your client. Now try to turn and see if this is going to be different, both sides. Is that better?
I think so, yeah, at least.
It's better. So we can switch eye, we can try and play with that. So learn this on our channel, learn all this program, and like I said, we're gonna take you to the next level. August 16, 8:30, 8 hours program. We work individual. It's only 9 people in the class. You will learn, you will start using this technique and progress. So yes, eye position and shoulder, we check the hips, we check that upper cross, lower cross syndrome. I believe he don't have upper cross syndrome, but he do have lower cross syndrome, a tiny bit. Okay.
So to summarize, what muscles kind of shorten, which are lengthened, where I need to stretch, where I need to make the strengthen, the kind of things.
Yeah, so I did assessment. Now I'm work. I'm explain the customer before he's laid down on the table what to expect. I never leave my clients in the room, say, okay, just lay down, I'm coming back. This is what most of the time therapists do. I'm just coming back. I'm explaining everything step by step. Okay, so now we're gonna do mobility. exercise. I'm going to apply my hands. Make sure it's no pain. You always tell me if any pain present. If you don't like something, you also let me know, because sometimes if you don't explain this, people experience pain during massage. I saw that people come in with the shoulder pain. They grab that shoulder, they try to pull him up and hold him in the air, do all this whatever, Thai massage. They just think about it. The guy have shoulder pain, they grab that shoulder and pull him forward. So his head like this and the arm is in the back. And person experience pain, but he think he's going to release through the pain. No, the pain is bad. It's non-functioning. So always explain to my client, if you experience pain, please let me know. Also, I show him what to do, how to undress, how to lay down. So take your clothes, leave your underwear, lay down between sheets. We start face up. Whatever your technique is, you start face up, face down, side position, it doesn't matter. Explain, I left that room, he lay down, I come back, we did the work. Now it's time to get that sales. Explain what I find out. So Daniel, yes, what we find out, you get subscapular muscle problem. You also have a little bit OA joint. Mm-hmm. So it's kind of jammed, your neck. What you need to do, you need to pay attention how you sit, what exactly you do, like, because we ask what he's doing. We know he's a massage therapist. But people most of the time in the office, they have a double screen. So I always tell them, just look, just see how you look at the things, because if you got this problem, that tilt, people might doing this. They sit in the computer, they always tilt this way.
Watching my phone always like that.
Exactly. So you see, we catch him. We tell him already. So now he's going to switch that bad habit. If he can catch himself all the time, he's going to switch that bad habit not to the right, he's going to switch to the left. And he's next in 2 months, he's come back to the left. Because this is, you repetitive motion build this pattern and that postural. So that's why we try to break this pattern away and teach the clients what to do at home to do those homework. So I will probably work on your hip. I mean, I will if I be therapist. And I'll tell my clients, we need around 5 sessions to feel that difference. And I see how this is going to react. Like 5 sessions, we can improve that hips, we can improve that neck, we can definitely mobilize that and work on that subscapular. Also, I give him homework, which is on our channel. I give him link to do those exercise and bands and see how this is going to get improvements. So try to sell that package right now, because he got some issue and we need to work on that issue. Like I said, if you don't do anything, you work, he might feel good, he not gonna feel good, whatever. It's definitely not gonna work. Maybe for a couple of days. So create that long relationship and start sell those packages. Of course, give him discount, attract your client, and do soap notes. So this is my tool, what I use. If he's come back second time, I add new strategy, which is called triple R. It's a review, referral, and rebook. Of course, rebook, we will already try to sell package. Review. Always try to ask your client to leave the feedback about your business. It's really important. That platform, Google, even AI love it. We just asked that question of AI today, ChatGPT. He said, I'm still referral from those reviews. So ChatGPT read those reviews and introduce your business to people who ask ChatGPT, whatever, if they use it as a search program. This is really important. Try to sell package, try to build this program, and get this long relationship with the clients. And of course, ask him to referral to the clients after good effect. And don't forget the last part, after we didn't work on him, ask him to do those movements again. If before the session he can lift only up here, but if you work and he can go completely full range of motion, that's already big benefits. And people will come back to you, people will buy your service because they feel benefits of your work. If they don't feel benefits, they usually people do, how do you feel?
I mean, right now, after.
I mean, yeah, there's just, of course, I didn't work on you. It's just no difference. But
Okay, let's pretend. I feel
yeah,
much
you
better.
pretend, of course. Yeah, yeah, we always lie here. But so yeah, okay. Then this is what people do. Great. So today extra water, and I will see you whatever when I'll see you, and that's it. Trust me, those customers will never come back, and they might forget about your name. They might be remember it later, maybe when they're going to be in pain. What you're doing, you are do retest. You ask him to do again. Like what's the most was the problem? Turn the neck. If you turn the neck and he feel difference, he's going to be say, "Wow, thank you." And it's like I said, it's give you this more trust in you and your work, and people will come back and refer more and more people to you. You need to be prepared for this. So this is the class for kind of sales and assessment program, which is we're going to do in August 16 at 8:30 for 8 hours here in clinic and live streaming on Patreon and YouTube members. So sign up, it's 50% off. We'll teach you how to be more professional and make more money. All right, so thanks for watching, guys, and we'll see you next week. You guys have a good day. Subscribe, put your questions in descriptions, ask those questions, sign up with the Patreon because we get more interrupted with the clients up there, with our members. You guys have a good day. Bye-bye.